Hello everyone, myself Mr. Muhammed Ameen M P, Assistant Professor, Department of Pharmacology, Yenepoya Pharmacy College and Research Center. Today I am going to take my topic Angina Pectoris. Coming to the specific learning objectives, at end of the session you should able to define what is Angina Pectoris, to know its etiology and clinical manifestations, to explain pathophysiology of angina, to know the diagnosis and treatment of angina pectoris. So coming to the definition, what is angina pectoris? Angina pectoris is clinical syndrome of ischemic heart disease resulting from myocardial ischemia. It is characterized by paroxysmal pain in the substernal, that means in the central part of the chest, which is induced by exercise and relieved by rest and may spread to our jaw and arms. So when a pain is moving or it's spreading to jaw and arms, at that time only you go to the doctor and consult, no need to take the self-medication. Coming to the types of angina pectoris. There are mainly three types of angina pectoris. The first one, that is stable or typical angina, Prinzmental or variant angina, and third one, that is unstable angina. First one, that is stable or typical angina. It is a most common form of angina characterized by the attack of pain followed by a physical exertion or emotional excitement and relieved by rest. Coming to the second one, variant angina. So difference is there from the stable and variant. It is characterized by the pain at rest and has no relationship between the physical activity. But in the stable angina, it mainly when pain is there at the exercise time, but variant angina, pain is not there at the exercise time, but resting time the pain will be there. That is the main difference. It may occur due to the sudden vasospasm of coronary artery due to the atherosclerosis, or may be due to the release of vasoconstrictor by mast cells in coronary artery. Coming to the third one, that is unstable angina. This is the severe form of angina. It also called as pre-infarction angina, characterized by more frequent onset of pain on prolonged duration and occurs at rest. So the difference between this unstable angina is when you are taking a rest and also you are taking exercise time, both time pain will be there. Coming to the risk factors. These all are the risk factors of angina pectoris: modifiable risk factor and not modifiable risk factors. Modifiable risk factor means we can modify and we can prevent the angina pectoris, and non-modifiable means that is a familial history or genetic one. So modifiable risk factor: tobacco use, high blood cholesterol or triglycerides level, lack of exercise, obesity and stress. Non-modifiable risk factors, that is family history of heart disease, older age. So when the older age, the vessel or nerves become constricted, that means vasoconstriction, the blood will not flow, leads to the angina pectoris, and also diabetes mellitus, high blood pressure. Coming to the etiology and cause, the main cause of this angina pectoris, that is development of atherosclerosis. Atherosclerosis is nothing but it's a formation of plaque materials coronary artery. So coronary artery disease is through to begin with the damage or injury to the inner layer of the coronary artery, sometimes as early as childhood. The damage may caused by various factors I already explained. First, that is smoking, high BP, high cholesterol, diabetes or insulin resistance, and sedentary lifestyle. Sedentary means long you are sitting, means in office works or any other work, sitting and doing. So it may cause the angina pectoris. Coming to the important portion, that is pathophysiology of angina pectoris. So the pathophysiology means due to any cause. I already explained what are the causes, that is smoking, alcohol intake, and also high cholesterol food intake. Maybe any causes, due to any causes, increase the oxygen demand, increase heart workload, heart need more blood to supply. The coronary arteries dilate and supply more blood to the heart. But due to any factors, blood supply is defected, the blood will not be circulated. That heart needs more blood demands, decrease the oxygen in heart and develop the condition of ischemia. That is when develop the condition of ischemia. The ischemia is known as a lack of oxygen. It start pain in the chest muscle, that is known as angina pectoris. Coming to the clinical manifestations, there is very important cardiovascular manifestations, that is ischemia, low cardiac output, chest pain, decreased pulse rate, diaphoresis, that means excessive sweating and ECG changes, and respiratory manifestations, pulmonary edema, chest heaviness, dyspnea, that is difficulty in breathing, and fatigue. Come to the genitourinary manifestation, decreased urinary output may indicate cardiogenic shock, gastrointestinal manifestation, nausea and vomiting. And coming to the skin manifestation, cool, clammy, diaphoretic and pale appearance on the skin. Move to the diagnostic evaluation. These all are the diagnostic evaluation of angina pectoris. First, physical examination. Next one is history collection, stress test, chest X-ray, ECG, echocardiogram and cardiac catheterization. This is nothing but angiogram. Move to the complications of angina pectoris. These all are the complications. First one, heart attack, heart failure, abnormal heart rhythm, that is known as arrhythmia, stroke and cardiac arrest. How to prevent the angina pectoris? Quitting smoking, that is a very important prevention, that is quitting smoking. Monitoring our vital signs, that is our BP, high cholesterol, diabetes, pulse rate, everything we have to check, and reducing your stress level, limiting alcoholic consumption, or you are addicted to that alcohol, you have to take 2 drinks or fewer a day for men and 1 drink a day or less for women. Next to the management, here 2 management is there, medical management and also the surgical management. Move to the medical management. Various drugs can be used to treat the coronary artery disease, including vasodilators. Why we are using vasodilator means these drugs act at the blood vessels and dilate our blood vessels. That example, nitrates. Next, beta blockers, decreases the workload in heart, that is propranolol. Calcium channel blocker, example, nifedipine and verapamil. Anticoagulant, heparin. Opiate analgesics. At that time pain will be there. We have to reduce the pain by taking morphine sulfate. Next, we will go to the surgical management. The 2 surgical management is there, angioplasty and coronary artery bypass surgery. But coming to the first one, angioplasty. Angioplasty is a minimally invasive medical procedure used to open a narrowed or blocked blood vessels, especially arteries, to improve blood flow. It is commonly performed to treat coronary artery disease, where plaque is built up, restricts the blood flow to the heart. Coming to the procedure of angioplasty, during the procedure, a thin tube, that is known as catheter, with a small balloon on the tip, inserted through blood vessel, often in the groin or wrist, and guided to the affected artery. The balloon is then inflated at the blockade site and compressing the plaque against the artery wall to widen the artery and restore the blood flow. Sometimes a stent, a small wire mesh tube, is placed to keep the artery open long term. Angioplasty can relieve the chest pain, that is angina, to improve the physical capacity and reduces the risk of heart attack. Coming to the next procedure, that is coronary artery bypass surgery or coronary artery bypass graft. That surgery is a procedure used to improve blood flow to the heart by creating a new pathway around the blockade or narrowed coronary artery. This is nothing but open heart surgery. It is typically performed when arteries are significantly blocked due to the coronary artery disease and can no longer supply a sufficient blood to the heart muscles, often causing chest pain and increasing the risk of heart attack. Coming to the procedure, the surgeon takes the healthy blood vessel from another part of the body, usually the leg. The leg contains the saphenous vein and chest internal mammillary artery or arm, that is radial artery. This vessel is then grafted. Grafted means attached the above and below the blockade in the coronary artery, effectively bypassing the blockade section. Blood can then flow through this new vessel and restoring the normal blood supply to the heart. Then The CABG, that is coronary artery bypass grafting, improves the symptoms, enhance the heart function and can reduce the risk of future heart attacks. Recovery can take weeks to months, and the procedure is often completed with lifestyle changes and medication to maintain heart health. These all are my summary. The first, what is angina pectoris? Angina pectoris is often the medical term chest pain or discomfort due to the coronary artery disease. It mainly occurring when the heart muscle does not get much blood as it needs. This usually happens because one or more the heart arteries narrowed or blocked. These all are my reference. Thank you.